you're a cyclist, right?
Yes.
Is that something you would like to do with him one day?
Nope.
It's only
I
100
don't.
miles, come on.
I don't think I could catch up. Although I do cycle with my son.
Yeah.
But with a 12-year-old, it's totally different than an athlete.
It's the same thing. Pretty sure it's the same.
Erik and I first met in the EP lab, him representing a medical device company. And over time, that relationship of a colleague developed into a doctor-patient relationship.
I had a choice of where I could go to have my procedure done once I found out I had A-fib, but I drove past probably about 6 hospitals to get to Dr. Gambhir. The symptoms that I first experienced were back in 2019. I woke up to cook breakfast for my kids and I felt like I had some palpitations or like a floppy fish in my heart that wouldn't stop or slow down. I didn't feel anxious. I did feel tired, felt a little sweaty. Typically I ride anywhere from about 80 to 100 miles per week on my bike, but that day even getting up the steps was a little bit difficult. I had to take a break. Even saying complete sentences after a while was a bit difficult as well.
So when Erik first came to me, he was having some palpitations. Because he is very vigilant about his health, he was able to quickly diagnose himself with at least an understanding that there was something wrong with his rhythm with a smartwatch. Most of these smartwatches typically detect these things as atrial fibrillation. However, he didn't have a definitive diagnosis until we implanted a monitor. Atrial fibrillation is an irregular, disorganized activity of the top chambers of the heart. Typically, that manifests as palpitations initially. However, not everybody feels palpitations. Some people just feel fatigue or worn out, and some people feel shortness of breath with exertion. As somebody like Erik, who was an avid cyclist, during his episodes, it would affect his stamina. The most important decision point for Erik was to understand how best to manage his atrial fibrillation and how best to manage his work-life balance along with it, and understanding the best treatment strategy for him.
Dr. Gambhir took a more conservative approach in treating A-fib. Those involved lifestyle changes, more water, less stress, less caffeine, and I felt a lot better from that first stage. After the lifestyle changes and more conservative approach to managing A-fib, Dr. Gambhir took the approach to the pill in the pocket, which is taking a pill as needed if I have any changes in my heart rhythm. Also, we moved on to a more direct approach by having cardioversions, which is just a shock to the chest. You don't feel anything except better when you wake up a few minutes later. To commemorate the cardioversions that I had, I actually ended up getting a tattoo for every cardioversion that I had as a celebration of life for myself. Thereafter, since those cardioversions worked really well at first, but my A-fib was more persistent, we had to take a more direct approach.
At Northside Hospital Heart Institute, we provide a tailored approach to atrial fibrillation care for each patient. About a year ago, when his episodes became a lot more significant and they no longer could be treated with as-needed medications, we would be ready to discuss a more invasive treatment options, which was cardiac catheter ablation procedure. That is one of the most unique things about our team, as well as our ability to provide the latest technology.
What I found is that my experience with Dr. Gambhir was very different than every other experience that I had with every other EP. You made me feel reassured about having you as my physician, your level of care, your level of empathy, your level of compassion, and more importantly, your level of skill. I've seen so many things that I've learned from you on the side of industry that I've been able to take to other labs and help them to become better in their practice as well. So that was very reassuring to know that someone of your skill set would be there to help me in the way you develop the new technology and make it your own.
When you first came to me as a patient, we talked about what your expectations and values were, and I think those were so important for us to understand what were the right decision making. I think you did have a lot of stress in your life, managing work, managing family, and I think you worked through all of that stress and understand that was affecting your health. I'm very proud of where you are with that.
Thank you. So my message to others is to not ignore the symptoms. The longer that you wait, the more difficult it is to address. Tomorrow may never come, so I think you should address it today. It doesn't take very long. I actually don't remember anything. It was really pleasant, really quick. The turnaround was fast. I showed up in the morning, I left that afternoon, and I was good to go from there, back on my bike very soon.